Hello everyone and welcome to our third video. So this is module 3 part 1 and we are going to talk about diagnosis and assessment. So in this video you will learn about the art of diagnosing and why is it important when it comes to abnormal psychology and especially in the treatment portion. And of course, we will look into the assessment process on how the assessment process can help the clinicians make correct or accurate diagnosis. So this is module 3 part 1 and I hope you learn a lot in this video. So first is diagnosis. So when we say diagnosis, this is the classification of disorders by symptoms or signs. The diagnosis of a mental disorder is a process that begins with qualified licensed practitioner. Mental disorders are unique mental conditions because there are no laboratory tests that can be administered in order to help the clinician make an accurate diagnosis. This complicates the process and allows for more erroneous diagnosis than other types of medical conditions. So to help clinicians avoid such errors, classification systems have been developed utilizing common nomenclature. Such nomenclature enables clinicians to effectively communicate with one another in a specific manner, resulting in a better overall treatment of a patient. The two most widely used psychiatric classification systems are the International Classification of Disease System or the ICD and the Diagnostic and Statistical Manual of Mental Disorders or the DSM. So, in diagnosis, this involves the classification of disorders by symptoms or signs. So when we say signs, these are objective, observable behavior that can be seen. So usually, those signs are observed by third party. So for example, the clinician, the family member, the relative, or the friend. Meanwhile, symptoms are behaviors that are subjective to the client or patient. So, for example, in depression, it's a combination of signs and symptoms observed in the patient or the client. So, examples of sign is, for example, your family member noticed that lately you are not eating regularly or stop eating or overeat, which is not typical or normal when it comes to dieting. Another is they notice that you are sluggish or they notice that you seem to not do what you love. For example, your hobbies or your passions, or for example, lately they observe that you have a difficulty in your online classes. So that is an example of the signs. What is important is the observable behavior that they can see. Meanwhile, symptoms are subjective experiences, subjective behavior. So, for example, in the same disorder, depression, so symptoms include you yourself, you feel sad all the time. You feel that you might cry. Another is you lately, somehow similar with the sign, lately you do not enjoy what you love. You have also difficulty in concentrating and you feel that the world is really slowing down. So that's examples of symptoms because those are subjective experiences. So the difference between sign, symptom, and syndrome. So syndrome are a group of symptoms. So I hope that our terminologies are clear regarding that. So one important reminder is that the process of diagnosis is or can be done by qualified licensed practitioners only. So who are the qualified licensed practitioners? The licensed psychologist and the licensed psychiatrist. So what we are doing here in class, this is just a practice. We are not technically allowed to diagnose someone because we are not professionals. We are not psychologists. We are not psychiatrists. So in this class, in our activities, this is just practice, pretend, so that we can practice how we can observe certain behaviors certain signs and symptoms to different disorders. So, of course, to help clinicians avoid errors, this is where assessment comes in, but I will explain assessment deeply later. And to avoid errors also in the diagnosis, a classification system was established, and the two most common books or two most common nomenclature or classification of disorders are the DSM-5 and the ICD-10. So the DSM-5 is most commonly used in the US and also here in the Philippines, but in Europe and in other parts of the world, they also use the ICD-10 or the International Classification of Diseases system. So what are some advantages when it comes to diagnosis? So the first one is that diagnosis can be the first major step in good clinical care. So that's why they say early diagnosis have a good prognosis. When we say prognosis, that is the development of the disease or the disorder. So good prognosis means that there are less symptoms, there are less signs. The patient means are functioning well in society, in his or her life. So that's why diagnosis is a major step in good clinical care so that the patient or client can prepare himself or herself in the treatment process. So another is correct diagnosis allows the clinician to describe base rates, causes, and treatments. So correct diagnosis can help the clinician to know what caused your disorder. So in our class, we use the biopsychosocial model of describing the causes of behavior. So biological, psychological, and social. And of course, correct diagnosis can help identify which treatment is best for the patient or the client. So which therapy are beneficial for them or which medication helps reduce the symptoms. So another is diagnosis helps a person understand why symptoms are occurring. So it helps the patient mark signs and symptoms before an episode can happen. So for example, in a bipolar disorder, so in bipolar we have mania and or hypomania and depressive episodes. So when we say hypomania, so there is an increased energy, there's also irritability. So diagnosis can help the person understand or take note of the prodromal syndrome. So when you say prodromal, it means before a major symptom. So for example, a small irritability, a patient can identify or can help him or her mark that, oh, because I was stressed and I did not sleep well, so this may cause my irritability right now. So it can help prevent an episode through diagnosis. And lastly, use assessment procedures to make a diagnosis. So this is where our role as psychometricians come in because of the use of psychometric tests or psychological tests that can help the clinician diagnose properly. So assessment procedures, like for example, another here is clinical interview. So those are the advantages of diagnosis. So what are the cornerstones of diagnosis and assessment? So these are important things that we need to remember or we need to realize before we can ever diagnose someone. So first is, of course, the reliability of the diagnosis. So I won't really dive into this reliability and validity because I will explain it deeply in your psychological assessment, but I'll just run through it. So when we say reliability, it is the consistency of measurement. So how consistent are the signs and symptoms in that certain person before we can say that we can ascertain that that person has depression, has bipolar, has schizophrenia. So there are different kinds of reliability. The first one is inter-rater reliability. So when we say inter-rater reliability, this is the degree to which two independent observers agree on what they observe. So when we say inter-rater, it means that they have two observers who would try to agree on the diagnosis or the observations they have seen with the patient. The test retest reliability. This is the measure the extent to which people being observed twice or taking the same test twice. So for example, after a period of break, received similar scores. So test retest reliability, this is common in psychometric tests, especially in, for example, those who have intervention in between them. So, alternate forms of reliability, the extent to which scores on two forms of a test are consistent. So, two different psychological tests, but they have equivalent items. Internal consistency, it assesses whether items on a test are related to one another. So, internal consistency reliability, usually they use statistical tool to measure that. And how do we know if our measurement is reliable? So, reliability is measured on a scale from 0 to 1.0. So, meaning the higher the number, the higher the reliability. And usually, in clinical settings, 0.9 reliability is already high. But for research, it's usually 0.7 to 0.8. So next is validity. So there are different kinds of validity, but validity is the index where a measure measures what it's supposed to measure. So does the tool really measures what it's supposed to measure? So for example, in the clinical assessment, does your interview form really measures or identifies the signs and symptoms in a certain disorder? So how valid it is. So there are different kinds of validity. So the first one is content validity. Content validity is whether a measure adequately samples the domains of interest. So for example, social anxiety measure should have items covering feelings of anxiety in social situations. So another example of that is your midterm exam. So content validity means that modules 1 to 3 should be representative in that midterm exam. So, to be considered content valid. Another is criterion validity. It is evaluated by determining whether a measure associated in an expected way with some other measure or criterion. So, in criterion validity, you have a criterion or an established test to compare with. In concurrent validity, both variables are measured at the same point in time. Example, showing that a measure of negative thoughts is associated with a measure of depression symptoms. So, concurrent validity. Predictive validity is the ability of the measure to predict some other variable that is measured at some point in the future. So, for example, IQ tests to measure future school performance. So, both concurrent and predictive validity are under criterion validity, and what is common between the two of them is that they have a point of reference or they have a standard to compare to when it comes to their tool of assessment. So, the difference is that for concurrent, it is measured at the same time and with the same variables involved. However, predictive validity is the criterion you have is in the future. So the point of comparison is in the future. Next is construct validity. This is used to interpret a test as a measure of some characteristic or construct that is not observed overtly. So for example, people score differently on a measure for anxiousness actually do differ in degree of that of the construct. So this is evaluated by looking at the wide variety of data from multiple sources or related to the theory. So usually in construct validity, you are looking into whether the construct or the definition of the construct really measures or is in a relationship with the tool you have in assessment. So, validity is related to reliability. Unreliable measures will not have a good validity. But having good reliability doesn't mean or doesn't guarantee that the tool is valid. So, those are just the things that you need to remember when it comes to reliability and validity. Now, let's proceed to the different psychological assessment procedures that or a clinician would do. So first is clinical interviews. So a clinical interview involves counselors asking individuals questions to gather pertinent information. In interviewing, therapists attempt to help individuals feel comfortable so that candid and relevant information is revealed. So, both formal or structured and less structured clinical interviews. So, there are two types, formal or structured and unstructured. So, but structured interviews are considered more reliable because there is a standard and it's uniform. So, what are characteristics of clinical interviews? So, the interviewer pays attention on how the respondent answers question or doesn't answer. So, it looks for emotion that accompanies responses. So, another characteristic is they establish rapport with the individual, obtain their trust, and empathize. Also, the interviewer must rely on intuition and general experience to figure out on how to best gather information, and unstructured interviews are less reliable than structured. So, in structured interview in relation to clinical interviews, questions are set out in a prescribed fashion for the interviewer. So, for example, the structured clinical interview guide. This is being revised in the DSM-5. And a person's response to one question determines what the next question will be. So this is what they call branching interview. It gives instructions as to when to go into more detail and when to move on. And most symptoms are rated on a 3-point scale of severity. Clinicians using unstructured diagnostic interviews tend to miss comorbid diagnosis. So that's why in your assignment, I have a guide there when you would do your interviews, and it's called the mental status exam. So the mental status exam there will help you or will guide you in what behaviors you should take note of, what signs and symptoms you should also take note of when it comes to the patient or client that you are going to interview. So, we also have assessment of stress. So, when we say stress, this is the subjective experience of distress in response to a perceived environmental problem. And most common stressors are life stressors. So, these are the environmental problems that trigger subjective sense of stress. And two of the tools that are used for measuring stress are the Bedford College Life Events and Difficulty Schedule and the Self-Report Stress Checklist. Just a brief description of the Bedford. So, it includes an interview that covers 200 different kinds of stressors, and it's designed to address a number of problems in life stress assessment. So, the goal is to exclude life events that might just be consequences of symptoms, and tries to carefully date when a stressor has occurred. And life stressors are robust predictors of episodes of anxiety, depression, schizophrenia, and even a common cold. So for the self-report stress checklist, so this is a quicker method of assessing stress. An example of it is the list of threatening experiences or the psychiatric epidemiological research interview life event scale. So this lists different life events. Participants are asked to indicate whether or not these events happen to them in a specified period of time. So we can see here in the assessment of stress the importance of the environmental factors in diagnosing. So in our biopsychosocial model, environment or the social environment is also a factor, and life stressors are one of them. So examples of life stressors are, for example, getting married, getting fired in the work, death of a loved one, or there's a calamity that happened. So those are different life stressors that may affect the mental health of an individual. And these two tools, the Bedford and the self-report stress checklist, are tools that can help the clinician properly diagnose if there are certain signs and symptoms of mental disorder. So this is where we come in as psychometricians. So, personality tests, these are the most common types of psychological tests. So, personality and intelligence tests. And in our subject, psychological assessment, I will deeply discuss the different kinds of tests in different areas. But what is important here is for us to know what's the difference between a psychometric test and a projective test. So, first are personality tests, and we have here self-report personality inventories. So, when we say personality inventory, the person is asked to complete a self-report questionnaire including whether statements assessing habitual tendencies apply to him or her. So, this is administered to analyze how certain kinds of people tend to respond. And what is important in personality tests is that it is standardized, or the process of standardization is the process of establishing statistical norms for a test. So meaning there is a point of comparison in which we can assess your personality. So, an example of a standardized personality test that is used in a clinical setting is the Minnesota Multiphasic Personality Inventory. So, this is designed to detect several psychological problems based on responses to certain items in a similar manner as individuals with a particular diagnosis. So, the MMPI 32 is a much more reliable and has adequate criterion validity. And there is one advantage of the MMPI is that it can detect whether you are faking good or faking bad. So when we say faking good or faking bad, you are trying to manipulate or lie in your personality test. So another important thing that we also need to identify besides psychometric or self-report personality inventories, we have projective tests. So, projective test is a psych assessment tool in which a set of standard stimuli or ink blots or drawings, ambiguous enough to allow variation in responses, is presented to the person. So, because the stimulus materials are unstructured or ambiguous, the person's responses will be determined by unconscious processes and will reveal true attitudes, motivations, or what you call the projective hypothesis. So this is used when the subject is assumed to be unwilling or unable to express the true feelings when asked directly. So projective tests are anchored upon the psychodynamic theories. Okay, if you remember psychodynamic theories, Freud and company. So that is the theoretical framework that it is anchored upon. So the two types of projective tests are the thematic apperception test and the Rorschach ink blot test. So in the thematic apperception test, a person is shown a series of black and white pictures at the same time and asked to tell a story related to each other or each picture. So meanwhile, the Rorschach ink blot test, a person is shown 10 ink blots one at a time and asked to tell what ink dots look like most and what ink blocks look like. The most well-known scoring system for the Rorschach is the Exner's scoring system, and it concentrates on the perceptual and cognitive patterns of a person's response. And in general, projective test responses are viewed as sample of how the subject perceptually or cognitively organizes real-life situations. And the norms of this scoring system is only based on a small sample and compared to the psychometric tests, okay, or self-report personality inventories, they have a norm or a standard in which they can compare you to a group or a population. So validity with assessing certain issues and not with others. So as psychometricians, we are only allowed to administer and interpret personality tests that are psychometric in nature. Projective tests are reserved for psychologists. So I will just discuss the license more deeply in our psych assessment. But just remember that we as psychometricians, we are only allowed to administer and interpret and make a psych report based on psychometric tests. We can still also administer and interpret projective tests, but it must be with the supervision of a licensed clinician. So, besides personality test, another test that is most popular when it comes to diagnosing is the intelligence test. And the first intelligence test was created by Alfred Binet, and that's what we call the Simon Binet intelligence test. But then it was imported to America, and now it's called the Stanford Binet intelligence test or IQ test. So when we say IQ test or intelligence test, it is used to assess a person's current mental ability. So this is based on the assumption that a detailed sample of a person's current intellectual functioning can predict how well he or she will perform in school. So this is what Alfred Binet created. The first intelligence test is Binet-Simon scale. So this became the basis for the intelligence test that we still use today. And like I said, it was imported to America, and Americans, and the Simon Binet test became the Stanford Binet intelligence test. And one of the most common intelligence tests that are also being used to help in diagnosing is the Wechsler's Adult Intelligence Scale, and the Stanford Binet intelligence test. So these are more common in the clinical setting. So the importance of intelligence tests, it's because it would help us in identifying normal intelligence from those who need more help, those who are in the subnormal, or what we call those who have intellectual disability. So it would help schools also to include or help teachers also to prepare a good curriculum for that person who has intellectual disability. So another assessment that I want you to remember are the behavioral and cognitive assessment. So it assesses aspects of the environment, characteristics of a person, frequency of form of problem behaviors, consequences of problem behavior. So usually behavioral and cognitive assessments are often used when, for example, we are dealing with a patient who is a minor or a kid, and the kid cannot fully express symptoms. So through behavioral and cognitive assessment, we can assess whether the child has certain mental disorders. So there are different kinds of behavioral and cognitive assessment. The first one is direct observation of behavior. So the observer divides sequence of behavior into various parts that make sense within a learning framework. So for example, are antecedents and consequences of it. So when we say behavioral assessment, this is observing behavior and coding it. So somehow, in a way, the mental status exam that I'm going to discuss later in our synchronous class to help you guide during your interview. So the mental status exam has a set of descriptions of different behaviors in which that you are going to check whether you observe it or not in the patient or client. So another is self-observation. So self-monitoring, in which patient observes and track their own behavior and responses. And one of the behavioral assessment tests that or tool that they can use is the ecological momentary assessment, or the EMA. So this is the collection of data in real time rather than reflecting back. A person is signaled several times a day to ask to enter responses into the device. So one of the benefits of self-observation is that it can be used to collect a wide variety of data such as your mood, stressful experience, coping behaviors, and thoughts. So this self-observation assessment is helpful for identifying symptoms, so which are subjective experiences. But the limitations of self-observation is that behavior can be altered by a mere fact that it is being self-monitored, or reactivity. So it's prone to subjectivity and reactivity because the person knows that he or she is being observed. So a cognitive assessment, example of cognitive assessment is the cognitive styles questionnaire. So this is used to help plan targets for treatment and to determine whether the clinical interventions are helping. And one example of a cognitive style questionnaire is the dysfunctional attitude scale that is based on Beck's theory. So this is helpful when it comes to identifying what treatment methods or therapy is best for the client. So next is the neurobiological assessment. So in neurobiological assessment, there are different neurobiological tests such as checking reflexes, examining the retina, evaluating motor coordination and perception. So in the neurobiological assessment, this is to identify physical symptoms, especially to know whether the cause of a certain disorder is organic. When we say organic, it means this is coming from a deficiency or there's a problem really in a certain organ or body part. So, for example of which are head trauma. When we say head trauma, when you got into an accident and then your head or your brain got damaged because of the accident, and there are certain signs and symptoms related to a certain disorder, but the cause is not because of psychological or environmental causes, but an organic one, meaning it's because of the damage in the brain. So the different neurobiological assessment, I'm sure that you are familiar with them with your biopsych. So first is the CT scan or the CAT scan. So, or the computerized axial tomography. So this is an X-ray that passes into the horizontal cross-section of the brain, scanning it through 360 degrees. Scanner on other side measures radioactivity that penetrates the brain. So the MRI or the magnetic resonance imaging, so this produces pictures of higher quality than the CT scan and does not rely on radiation. So the person is placed inside a large magnet that causes each atoms of the body to move. So in fMRI, last or the functional MRI, it allows researchers to measure brain structures and function, and it allows quick pictures to allow metabolic activity to be assigned and measures blood flow in the brain or the bold signal. When we say bold, blood oxygenation level dependent, or as neurons fire or blood flow increases. So the PET scan or the positron emission tomography, this is a more expensive and invasive. It allows the measurement of brain structures and functions, but it's not as precise as an MRI or an fMRI. And there is a radioactive isotope that is being injected into the bloodstream and binds into the glucose. So red means most activity, blue or black means less activity, and the PET scan is used less often. So we also have here the functional connectivity analysis. So this tries to identify deficit in the ways in which different areas of the brain communicated and connect with one another. And one of the methods in functional connectivity analysis is the neurotransmitter assessment. And usually neurotransmitter assessment is done post-mortem, or when you say post-mortem, it means that the person or the patient is dead. So, bind receptors in deceased patients to detect amounts of certain receptors in the brain. And we have what we call metabolite assays, or it is an acid byproduct that is produced when the neurotransmitter is deactivated. So this metabolite is often found in urine, blood serum, and cerebrospinal fluid. So this is not a direct reflection of neurotransmitter levels of the brain or the blood and urine. So metabolite studies are correlational, but they are not always accurate. So the reason why I did not really dive or explain further neurobiological assessment is because this is emphasized more in your biopsych. So I hope you got an idea of what they are. Let's now proceed to the neuropsychological assessment. And this is where also us as psychometricians come in. So when we say neuropsychological assessment, so who gives that? So first is the neurologist or the doctor, a physician who specializes in disease problems that affect the nervous system. So for example, stroke, muscular dystrophy, cerebral palsy, or Alzheimer's. A neurologist is focused more on the organic side of mental disorders, organic causes of mental disorders. Meanwhile, a neuropsychologist is a psychologist who studies how dysfunctions of the brain affect the way we think, feel, and behave. And I think in your biopsych, it is emphasized there that neuropsychologists are the ones that are specializing in biopsychology. So, what are neuropsychological tests? So, the neuropsychological tests are used with brain imaging to detect brain dysfunction and to help pinpoint specific areas of behavior that are impacted by problems in the brain. So this is based on the idea that different psychological functions rely on different areas of the brain. And we have here two groups of tests or batteries of tests. So we also, as psychometricians, can administer this with the supervision of a clinician. So the Halstead-Rayton Neuropsychological Test Battery, it measures tactile performance test, memory, test time, and speech sound perception test. So in tactile performance test time, so while blindfolded, a person tries to fit differently shaped blocks into spaces of a form board using the preferred hand, then the other, and then both. For tactile performance test memory, a person is asked to draw the form board from memory, showing blocks in their proper location. For speech sounds perception test, the participants listen to a series of nonsense words, each made of two consonants with long E sounds in the middle, then select the word they heard from a set of alternatives. So, for the Luria, Nebraska battery, it has 269 items, 11 sections, and it determines basic or complex motor skills, rhythm and spatial abilities, tactile and kinesthetic skills, verbal and spatial skills, receptive speech ability. So, the Luria, Nebraska battery helps reveal potential damage in the frontal, temporal, sensory motor, parietal, occipital area of either hemisphere. And the Luria, Nebraska, the advantage is that it has reliable scoring and can control for the educational level. So, the Luria, Nebraska can also be used in the educational setting, especially for children who have special needs. Last type of assessment is the psychophysiological assessment. So when we say psychophysiology, this is concerned with the bodily changes that are associated with psychological events. So this measures heart rate, muscle tension, blood flow, electrical activity in the brain, but it's not sensitive enough to be used for diagnosis of mental disorders. It assesses the activity of the ANS to understand emotion. And the types of psychophysiological assessment that are being used are, first is the electrocardiogram or the EKC. So it measures electrical charge generated by heartbeat. It measures electrodermal responding. The electrodermal responding, there is a skin conductance in the sympathetic nervous system and sweat gland activity. And the electroencephalogram or the EEG. So this measures brain activity using electrodes on the scalp. Abnormal patterns can indicate seizure activities to help locate lesions or tumors, and it's used to measure attention and alertness. So the neurobiological assessment, the neuropsychological assessment, and the psychophysiological assessment, these are looking more into the biological causes of mental disorders, looking into the organic causes of mental disorders. So, when it comes to diagnosing, the first thing that the clinician needs to know is whether or not the symptoms or signs are organic or not. So that's why a physical exam is first given before a psychological exam or a psychological diagnosis. So that's why the doctor is still asking you for your vital signs. So whether you have high blood pressure, the doctor is also asking you for your medical history, physical medical history, whether in your family there are people who have psychological disorders or people who have heart disease or other diseases, heritable diseases in the family. So the neurobiological assessment, it's more focused on the brain imaging. For the neuropsychological assessment, it is more focused on the relationship between your brain and your sensory motor movement, sensory motor skills. For the psychophysiological, it measures different electrical activities inside your body. So for example, the EKC and the EEG, it measures brain waves, electrical activity in your body. In summary, that's it. That's all for the part 1 of our lesson. So in part 2, I'm going to discuss about the history of the DSM and how we use the DSM now, the DSM-5 now. Okay, so see you in the next video. Bye-bye.